what's up, guys? So I've been having some stabbing pains in my shoulder, and then some lower back pain with like some radiating pain in my right hip. So I called up my chiropractor, Dr. Linne, and we are here to talk to him about what's going on. So let's go ahead and go inside, guys.
Hey, how can I help you?
Man, actually, I was gonna talk to Dr. Linne because I got some lower back pain, and when I kind of walk, my right hip hurts a little bit, kind of like it twinges. And then whenever I like bench or shoulder press or really any kind of pressing, my left shoulder gets like these stabbing pains in it, you know, kind of like right here at the top.
Yeah.
So I was wondering if y'all could kind of like fix me up a little bit, because I mean it hurts, you know, it's like almost borderline crippling.
Perfect. You came to the right place. What I'm going to do is I'm going to go give that information to Dr. Linne, and he'll be right with you.
Awesome, thanks.
You're welcome.
Hey, what's going on, man?
Oh, not much, man. How are
Dr.
you?
Linne.
Hey, Philip Archibald.
Nice to meet you.
Nice to meet you.
What brings you into our office?
Oh man, you know, I've actually just been dealing with some lower back pain. Like I was driving all weekend, and now it hurts, kind of like when I squat, stuff like that. And it's really kind of tight even when I'm just like laying in bed. And then whenever I get up and get moving, my right hip kind of hurts.
Okay.
Plus, I kind of noticed this yesterday when I was benching. My left shoulder, like right here, it gets some stabbing pains.
Okay.
You know, it's like anytime I press, it really hurts. So I was wondering if there was anything you could do for that.
Yeah, definitely. All that sounds like kind of in our scope of practice, what we do here on a normal basis. So
Awesome.
nothing too crazy, but come on back. Let's do a little consultation for you. So this is our office. So we got the roller bed. We got our decompression table. So this is really good for like disc herniations, anything like that. So anybody that's doing heavy lifting, running, just an active person in general. Sometimes that spine can get compressed, so this is a good way to decompress that. This is the roller bed table. Super awesome. Feels really good, but it's also going to do what's called intersegmental traction. So our spine, the way we get our nutrition is, you know, you typically will get your nutrition through eating, right? Our spine gets it through motion. So this is going to put motion in every segment of the spine. So
that's awesome.
Love this. We got our recovery lounger back here. So we have 4 of our recovery loungers. These are really, really good. So somebody that's working out 3, 4, 5 times a week. I know you already mentioned kind of your shoulder, right? And management stuff. So if you're, you know, you look like a kind of a built guy, so I'm gonna guess that you work out quite often. And that
yes,
kind of
sir.
Stuff. So doing that, if you don't have the right recovery process, your body's gonna hold on to these toxins, this metabolic waste, right? Your body can only get rid of it so fast.
Yeah.
So this is kind of a way to speed up that recovery, kind of help flush out the metabolic waste and help bring new oxygen to help repair that at a faster rate.
It's awesome. This looks like a relaxing little room too.
Oh yeah, man, we made it that way. So in here, this is where I say the magic happens. This is our, adjusting table. So we got ultrasound, which is really, really good. Another way to kind of help acute inflammation or maybe even a chronic condition that's just not healing. This is going to help heal that at a faster rate.
Awesome.
We got Graston, dry cupping. We got all different kinds of stuff in our office to kind of help with different kind of conditions. So let's go in here and we'll go ahead and do a consult for you. This is our examination room.
Sweet.
So we got our x-ray machine here. So, you know, if it's something that you want to do or something, you know, as far as going into an exam and kind of letting us get a better check of what's going on, the first step is going to be in this room. So we're going to do an exam on you. We're going to do a foot scan on you. This foot scan is a good way for us to detect, you know, how much weight from one side to the other, how your arches are supporting your body all the way up, right? I know you said hip problems, right? So if you have too much pronation on one foot, it's going to cause rotation. That could cause hip rotation, right? So this could be kind of an easy fix for you just right then and there, you know?
Yeah, that's really cool.
So, but yeah, let's go ahead and kind of go through the consult. So, you know, the shoulder injury is something that we deal with quite often. We see a lot of athletes in here.
Yeah.
But, you know, when you're dealing with that kind of shoulder pain, best thing to do is let us go through a proper examination. It takes about 10 to 15 minutes. We run you through a bunch of different orthopedic tests. That helps us narrow down exactly what it is, right? If it's bursitis, if it's impingement, you know, if it's a torn rotator, or, you know, if it's just a muscle that's kind of irritated, any different types of conditions. So same thing with the lower back. We'll do the same thing, take you through some orthopedic tests, kind of see exactly what's going on, help us pinpoint. You know, in the exam as well, like I said, we're going to do a foot scan, we're going to take x-rays, let us get a better idea of what's going on. You know, how long have you been dealing with this issue?
It's probably been like the past week or two.
Past week or two?
Yeah.
You know what you were doing? You remember what you were doing?
With the shoulder stuff, it just, you know, once I started lifting heavier is when it kind of started flaring up.
Okay.
Yeah.
Were you lifting like overhead, or were you lifting, you know, like doing deadlift?
More like whenever I bench or like press overhead.
Yeah.
So anything where I like use my front delt, you know.
Okay. Have you ever had a problem like this before, or has it just been the last 2 weeks?
No, it's just been recent.
Just been recent?
Yeah.
Okay. Do you remember exactly what it was? Do you remember what you were doing? Was it a bench press?
I feel like it hurts more whenever I do chest exercises.
Chest exercises?
Yeah.
Okay. But you don't remember exactly what you were doing, just kind of
No, it kind of like it will start hurting after like 3 or 4 sets in and just kind of like keep hurting.
Okay, and so now it's bothering you doing chest exercises.
Exactly.
And that kind of stuff. Are you getting any radiating pain down the arm? Is it real pinpoint?
No, it's just kind of like literally right here.
Right on the top?
Right on the top of my delt, yeah.
Okay. All right. Well, yeah. I mean, I think that's something that we could definitely help you treat here. I mean, I would definitely recommend, you know, letting us get you in for an examination. Tell me a little bit about the back, real quick. I know you said on that right hip area.
Yeah, it's just like really tight, and then whenever like I pick my foot up, it kind of twinges like right back here.
Okay, when you pick your foot up?
Yeah, in the back of my hip.
When it does bother you, are you typically going into a flex position to get relief? Or
yeah,
are you bending
I
backwards?
usually lie down.
Lie down in the health?
Yeah.
Okay. Are you having any radiating pain down your leg at all?
Kind of into my glute.
Kind of in your glute?
Yeah.
Have you ever been seen by a chiropractor before?
No, I've never actually been to one.
Never been to one before?
Yeah.
Okay, so we kind of do things a little bit different than your typical chiropractor. You know, I feel like I'm saying it every day, but, you know, you're not just going to come in here and we're not just going to pop you and adjust you and that kind of stuff. I'm not saying there's anything wrong with that. We just kind of do a little bit more. We deal with a lot of sports, so that tends to be more keeping people being able to do what they're trying to do, right? And also try to help people recover from acute injuries and that kind of stuff. So that's why we have all the different tools out there, and I'm training a lot of different soft tissue techniques. But yeah, we have kind of a different way of treating, so you're not just going to come in here and get popped. We're going to do a bunch of different stuff on you, which people tend to like, and we tend to get patients better in about 4 to 6 visits. So we don't typically do long drawn out treatment plans or anything like that unless it's completely necessary. Most of our patients, you know, are coming in here and seeing pretty good results within that time frame. So
awesome. Well, let's get started.
Yeah.
Awesome.
All right. So now what I'm going to do, just going to go through a few shoulder exercises for you here. First one I want you to do, bring your shoulder up like that, extend. And I want you just to bring the shoulder back. Is there any pain with that?
It's a little tight.
A little tight? Okay.
But no, it doesn't hurt though.
Okay, bring it back this way. Any pain with that?
No, just a little tight.
Okay, go ahead and hold right here, and then don't let me press down.
Okay.
Hold it, and don't let me press down. Good. Then bring it up. Good. Don't let me hold that right there. Don't let me press down. Or hold it. There you go. Don't let me press down. Perfect. And then bring it up here. Don't let me press down. Was there any pain with any of this?
Yeah, a little bit.
Feel
Right
it across right there? Yeah. Alright, so now what I want you to do is I want you to bring that arm out like this, and I want you to bring it over. Is there any pain when you do that?
No, not too much. It's just pretty tight.
Okay. And then same thing, I just want you, just let me hold on to the arm all the way, so dead weight. Any pain when you try to catch that? Okay. Next one I want you to do is I want you to come back here and I want you to try to touch that scapula back there.
Good luck.
And then I want you to try to touch it from the other way. So bring this back, almost kind of like you're getting arrested. There you go. And now do that with both arms. I just want to see this space. Okay, and then bring this arm back just to try to touch this.
Oh, like that?
Okay. And then do it the other way. And then bring that one back. Alright, so we got some pretty good separation there. Had some pain. I'm kind of up in the supraspinatus. Go face up for me. Let's take a look at this lower back here. Good. I want you to straighten this leg right here. Don't let me press down. So hold that up.
Yep.
Don't let me press down. Good. Bend this for me. Good. Hold that. Hold it. There you go. Don't let me press. Pull. Perfect. Don't let me press down here.
Okay.
Hold that up. Don't let me press down. Good. Don't let me pull up. Good. Straighten it back out. Good. Bring it out just like that. Hold that for me. Hold it up. And then don't let me pull it. Okay. And just let it relax. Alright. I'm going to turn your foot in just like that. I want you to hold that for me and don't let me press out. Good. And then turn it out for me. Don't let me press in. Good. Alrighty, sir. I'm going to lift this up. Is there any pain in your lower back? Anything going down the legs at all?
It felt a little tight on like the left side.
A little tight?
Yeah.
Okay. Just want to compare it to this side here. Any pain?
Yeah, right side.
Right side? Okay. Go face down for me.
Yep.
Yeah, so these are all just a few things that we would typically do on an exam. We typically do a lot more, but since you're in a time crunch, is there any pain when I press down?
It's kind of tight right where your right hand is.
Okay, down right here?
Yeah.
Okay. Nothing up in here?
Right there where your left hand is.
Okay.
Yeah, right there.
Right there?
Yep.
Okay. Good. What you do is I want you to go ahead and lift this leg up as high as you can without bending the knee. Good. Go ahead and lift the other one up. Good. And just let it relax. Does one feel easier than the other?
Left one felt easier.
Left one felt easier. Any tenderness or pain?
In that hip socket kind of.
Can I say something? Okay. Any tenderness and pain in here?
Nope.
Nope. Okay. How about on the side in here?
Not really.
No? Okay. Alright. Let me just double check this side here.
Yeah, right there where you just put your thumb.
Okay.
Yeah.
No tenderness in here?
Nope.
Alright, come on up.
Cool.
Now what I want to do is I'm going to take a set of x-rays on you, okay?
Awesome.
It's off. So we'll just act like it's...
Yeah. So where do I stand?
You're going to stand right over here.
Okay.
Shift to your left for me. This way. Yeah, that was your left. Shift towards me, sorry. Okay, keep going this way. There's go. Good. Right about there. Perfect. All that. And whoosh. And then, okay, so you want to add one again?
Yeah.
Alright. Now what I want you to do is I want you to rotate it out. Good, hold that. And then I want you to rotate it in.
Like that?
Yeah.
Cool.
Good. Perfect. And then let's go ahead and take the lower back. So go
Yes,
ahead
sir.
and actually shift to your left now.
Yep.
Good. Good, arms out. Good, hold that for me. Good, and then turn. We're gonna have your hand up here. Good, oh, your whole hand. There you go. And then hip all the way up against here. Good, and then this arm over. Good, take a small step forward. Good, and hold. And done.
Awesome.
All right, sir. So we'll go over the X-rays in the other room, and then we'll get started on you. Okay?
Awesome. Thank you.
Okay. So now we've looked at the X-rays and that kind of stuff, right? My kind of starting to see that there's probably some issues going on with your supraspinatus muscle and tendon, possible impingement as well. So kind of the way we're going to treat that a little bit is there's inflammation there. Right. So I want to kind of flush some of that inflammation out. So I'm going to have one of our girls come in. She's going to do ultrasound right there. Okay. It's also going to be combined with another electrotherapy. Cool. So we call it combination therapy. It's going to help kind of flush some of the inflammation out. It's going to help break down the muscle. It's also going to help that area repair at a much faster rate.
Awesome.
Okay. Once they're done doing that, that's going to help bring blood flow. But we're also going to use the Theraguns, the hypervolt guns on you. Kind of get these muscles to relax even more and just bring more blood flow before I come in and I start doing some of the grassing on you and some of my soft tissue work. So
what is grassing?
So grassing is going to be an instrument assisted tool. So this is just an example of one of the tools right here. So it's an instrument assisted tool. And so it's IASTM, which is another way of saying it. And this is going to help break down some of the fascia, right? So
cool.
You think of a muscle surrounded by fascia. Fascia to a muscle is like water to a water slide. So you're trying to help break some of that fascia down so that it glides properly and you have better range of motion.
It's almost kind of like you're lubricating the muscle.
Correct. So yeah, when that fascia's not doing what it needs to do, it can kind of cause problems, kind of decrease range of motion, cause the muscle to tighten up, and just, you know, and then it stays there for long periods of time.
Yeah.
It becomes chronic, and you don't want that. So since you said it's been going on for 2 weeks, it's still kind of in the acute phase of care. So we're going to try to break it down, kind of rehab it properly. We're going to do some passive therapies first, and then do some active therapy later.
Cool.
So first thing I would do is, now that the girls are done with the Theragun and the ultrasound combination unit, is I come in here, I start doing some ART, active release technique on this, some FDM, which is another technique called fascial distortion model. It's taking your body through different ranges of motion while I'm pinning the muscle, but also helping break down the muscle as well. So that's usually super effective. Awesome. And then I'll come in there, I'll do the IASTM or the grassing on you as well. Once we get that done, then if we need to, I'll do some dry cupping.
Awesome.
I find that dry cupping is kind of beneficial once it goes along with everything that we're doing.
Right, so it's not like the only treatment, it's kind of like a...
Yes.
I guess like a pain reliever.
Correct. Cool. Yep. Go ahead and go face down on the table for me.
Yes, sir.
So now that we've kind of completed that aspect, got the shoulder loosened up, got it feeling better, right? Now we're going to kind of work on this lower back, right? I'm also going to do some active release on this lower back on the left side, try to loosen up that around L5, S1. And I really want to loosen up these glutes, and we might work the hamstrings a little bit because releasing those are going to help take some pressure off this lower back.
Yes, sir.
Okay? So we'll do the Theragun on it, we'll do some of the FDM, the active release, possibly hit it with a little bit of the IASTM as well as the grasses as well. So now that we've done that for the hip and lower back as well as the shoulder, I'm going to put you on our flexion distraction table. So now this table's going up and down, right? It's giving you a nice pull in that lower back, helping decrease the pressure on that lower back. You think of, you know, you have some of the shooting pain going down your legs, a little bit of sciatica. It could be compression at the nerve root or the disc due to like a disc bulge or herniation. So I want to just give that take some pressure off. So we're just going to stretch you.
Yes, sir.
We're going to do this for a good 2 to 3 minutes. We're going to go through different stretching motions all the way up the spine, stretch different areas. We're going to stretch around this shoulder, try to loosen that up around the rotator cuffs and all that good stuff. So now that we've done doing that, now I'll move on to the adjusting part. So we're going to adjust your body full spine. So we're going to adjust the ankles, we're going to adjust the knees, we're going to adjust the hips, we're going to adjust the lower back, we're going to adjust the mid-back, we're going to adjust the shoulder 2 or 3 different ways. Really make sure the scapulas are where they need to be. They're not up or elevated or winging. Make sure the femoral head is where it needs to be as well, and then we'll adjust the neck on top of that. So you're going to literally get a full spine adjustment in here from us. So well, let's go and take you to some of our other therapies. So
awesome.
We're going to have you finish off on the crossover symmetry. So first thing we're going to have you do is you're going to come in here. I'm going to set you up on the decompression for your lower back. So this is a good depiction of what you would look like once you get that in there. So, you know, you're strapped in here just like this. So first thing we're going to do is this belt's going to go around you. It's going to act like a low back brace in a way.
Yeah.
Right? This is actually attached to the table. So this is going to also go around you like a back brace.
Okay.
But this is what's going to stop you from sliding down. This is what's being pulled by the machine here. And that pull is what's being able to be very specific and targeted at that L5-S1 that we saw on the x-ray.
So you're kind of getting rid of like the pressure around your
Correct, yes. So it's almost creating like a vacuum effect. So if you have a disc bulge poking onto a nerve or pressing into a nerve, that vacuum effect helps bring that jelly that's in the donut that's coming out back into where it needs to go,
cool.
right?
Yeah,
and so after a few treatments of that, it starts to work, starts to feel really good.
Awesome.
Yeah, I always talk about when I get off of here, it's just like, you just feel so much relief.
Now what's that table
so
where you
loose.
hang upside down? It's kind of like
Yeah,
that,
so the inversion table, so this is very specific, right? You're lying down, it's very specific. We can do different ankles and target at a certain weight and all that kind of stuff.
Yeah, that's awesome.
In inversion table, it's going to strap you into the ankle joints. You're going to go upside down. So I'm not a huge fan of them, and I'll tell you why. One is you have all this blood rushing to your head, right? Being upside down, which isn't a great thing. And then the other thing is yes, it's going to stretch the joint that needs to be targeted, but it's also going to stretch other joints that don't need to be targeted.
Gotcha.
Your ankle joints, your knee joints,
Right.
your hips, like all that kind of stuff. So what's the point of doing that? You know, I mean, yes, you're getting some relief, but why don't go and do something that is, you know, I would say, you know, under medical care, make sure you know what you're doing and why you're doing it.
for real though.
Yeah, so, all right, so now that we've done this, let's move on, and we're gonna get you into the recovery core, recovery pumps. So, we have two different ones that we will use on you, different times that you come in, right? This is a really good one for the lower back. We put in it, so it'll go up to kind of about here on you, but it also hits those hip flexors, those glutes, right? Some of what we talked about was a little bit of lower cross syndrome where there's some muscle imbalances going on.
Right.
So you have muscles working too hard, muscles not working enough.
Yeah.
And so we need to strengthen the muscles that aren't working enough, stretch the muscles that are working too hard. But that's where a lot of that pain's coming in. So this is going to help kind of get all that blood flow to that area, let those repair, kind of let them get some of that metabolic waste out. This one's the half jacket, so this is really good. It's for, we're going to put this on your shoulder.
Yeah.
One of the least most vascular areas in the body, and what I mean by vascular is there's not a lot of blood flow that gets to the shoulder.
Right.
So any way we can help that up, we're sitting here, we're breaking everything down, we're getting it back to where it needs to be in alignment, and then I like bringing that blood flow. So when I said earlier, like I'm kind of different than chiropractors, it's not that I don't think a chiropractic adjustment isn't sufficient enough. I just have found with what I do with the people and the athletes that I'm treating, doing a little bit more, you know, kind of helping the body out.
Like you kind of look at the whole picture.
Very much
around
so.
the joint versus just the joint
Very
itself.
much so. Like definitely the chiropractic adjustment is the bread and butter of what I'm doing, making sure everything's in alignment. But with what I've seen and what I've done in treating athletes, I feel like really working the muscles and breaking down the fascia and getting blood flow so the body can recover at a faster rate goes so well with an adjustment, and you just get fantastic results. And then the main reason that I have not been doing drawn out treatment plans is because I've noticed a lot of these muscle imbalances, they take time to correct. And it's time that you're gonna have to spend in the gym with trainers and doing things on your home at home,
like
on a consistent stretching and rehab and that kind of stuff. Yeah, and strengthening the right muscles. Because if you're not doing that, then it's gonna continue to come back. And that's the cycle that I've been seeing in my office. It's like, well, yeah, I've been to a chiropractor, but I was better for 2 or 3 months, and then all of a sudden it came back. And that's what I'm really seeing is if we'll get you better, but it's kind of up to you to stay that way.
Keep yourself better.
And that's where we've created protocols and that kind of stuff in our office for different conditions that have been very effective with people doing things at home. And trust me, I can tell the difference between someone doing it at home and somebody not doing it at home. So don't try to pull a fast one on me, fella.
All right.
And the way that you do it at home is through active care. So we're doing a lot of passive therapies in here. One of the active things that we do, we teach a lot of our patients the active care that they can do at home. But this is our crossover symmetry. This is really, really good for upper cross syndrome.
Yeah.
But it's also really, really good for shoulder rehab.
Okay.
And so with what I'm seeing with that forward posture and that kind of stuff, athletes are hurting themselves doing certain things, not knowing how to do proper lifts or having these muscle imbalances. So, you know, I'm not saying that's how you hurt your shoulder. I'm just saying this is something that we saw on the x-ray, and this is something that is causing you pain. These are something that we've been training. So now that we've just went through and we've done the grass and the ultrasound, broke everything down from a passive standpoint, now we want you to leave on a good note and strengthen that muscle, right? And the best way to do it is through low resistance. So these are some bands that we have. It's actually called crossover symmetry. I love it, and it's you know, I have all my patients take a picture of this so that they can see and remember what to do at home. It's always on their phone. We all are always on our phones, so this is a great way for you to be able to do these exercises that we teach you in here. And so it's one of those things that you do, and
that looks super
it's
helpful.
pretty good. So, but yeah, that's basically most of the basics of what we do. And like I said, everything we do in our office is customized to you. You're not going to see somebody doing the same thing that you do. We base it on functionality, so functional movement. We base it on, you know, whether it's acute, whether it's chronic, and everything that we do is custom here.
That's awesome.
And so yeah, we've been getting really good results with all of our patients, and so I think we'll get the same with you.
Sweet. So let me ask you just one more question, because I had a client ask me about this today. What do you think about cryotherapy?
So to be honest with you, I've never done cryotherapy myself, and so I don't know a whole lot about it. I like the concept behind it. I mean, you know, you're basically...
What is the concept behind it?
So the concept behind it is you're using, you know, you're basically getting in super cold temperatures, right, to kind of help your body recover and repair itself at a much faster rate, right? So a lot of the things that we just showed you, different therapies that we have in our office, it's helping your body. So it's helping your body get rid of metabolic waste and helping your body kind of function better and that kind of stuff. Like I said, I don't know much about it because I haven't used it personally. I haven't done it personally and that kind of stuff. But I've seen a lot of people do it, and a lot of people seem to like it. So
for sure. I've done it once, and I feel like it made a difference, you know, for like a day, and it's kind of back.
That's more,
But it's like you said, that you kind of have to keep working on things.
Well, I mean, my thought process behind it is, you know, it's using very cold temperatures, right, which is like using ice. So that you're using it, and you're hitting the whole body at one time. So ice is going to help kind of get rid of inflammation, get you know, cut swelling down. So that's kind of the concept that I think that it does, and what it
well, I would think it would improve blood flow too, at least afterwards.
For sure, yeah. So exactly. Yep.
That's awesome.
So,
All right, man. Well, I appreciate it. I'm definitely gonna come back in.
Yeah, definitely.
Sweet. Thank you.